Almost 1 out of every 4 women will die of heart disease, but did you know there's additional risk factors for women than there are for men? The Minestrone Women's Heart Center at Beaumont Health is one medical center dedicated to educating women about their heart health. And joining me this morning is cardiologist Dr. Pam Markovich, and she has some ways we can keep this at the forefront of our minds because it is so important.
It is our #1 killer, as you mentioned, Anne Marie. 1 in almost 4 women will eventually die of heart disease or stroke. And Beaumont, in fact, is doing a big women's event tomorrow to highlight this. It's been it's been Women's Health Month, I should say, at Beaumont all month, with a big mural about women patients and a lot of excitement over the issue.
And as a cardiologist, we hear that this is so prevalent for women, but I feel like we still don't always take care of ourselves.
You're absolutely right. I think women are learning that heart disease is their #1 risk, but they really have to apply it to themselves and remember to focus on your own health and as well as that of your friends and family, because women do have the tendency to take care of others more than they take care of themselves.
At what age should we start really thinking about these things and worrying about different signs and symptoms?
It's actually recommended that cholesterol be checked in our 20s.
Wow.
But certainly when we get into our 30s, we have to be concerned about the risk factors that we all have heard about: diabetes, high blood pressure, smoking. Of course, we want to quit smoking, and cholesterol, managing our cholesterol to keep those numbers low, if your bad cholesterol low and your good cholesterol high.
And we have all of those on the screen right now, and these are actually bigger risk factors for women than men. And when we think of cholesterol and heart health and things like that, I think we still think of men, right?
We do. In fact, we still typically think that this is a man's disease, but it's equally a woman's disease. And as you mentioned, there are risk factors that impart a greater risk to women than men. For example, diabetes is one of them. If you're a diabetic and you're a woman, you actually have about 4 times the risk of having a heart attack within 10 years. Not that it's not risky for men. Gives you about 2 times the risk, but 4 times for women, that's a bigger risk, and we really have to manage our glucose, eat healthy, and exercise.
What do you want women to know about their heart health?
I really want women to get checked out if they have the risk factors: high blood pressure, cholesterol, diabetes, smoking history. And also, if you have a family history of heart disease, it's really important to get checked out by your doctor. So family history is if you're directly related to someone, a man that had a heart attack at the age of 55 or less, or a woman that had heart disease at the age of 65 or less. You really have to pay more attention to that.
And you mentioned there is an event tomorrow. Tell me again when that's happening.
That is tomorrow afternoon. There's a luncheon highlighting women's health, and especially prominent among all women's health issues is heart disease, because it's our #1 killer and it's 80% preventable. It's something we can do something about. We can prevent this disease almost entirely, and we all ought to be exercising and eating healthy and relieving our stress and just doing things to, increase to improve our health. Mind, body, whole thing.
Some really good advice. Thank you so much, Doctor, for joining us today.